big breasts. Now, there are trends that are out there. Some people are saying that actually it's regionally dependent. Some places in the US, they go with huge breasts and that's their preference, but other places, maybe not so. What do you think, Sean?
So I agree with the geographic kind of tendencies. I do think in general my patients don't want their breast to enter the room before they do. But for every maybe 1 or 2 patients that want a subtle result, I have some patients that do want some voluminous breasts. And so I can't say that all women in Boston want small breasts.
What's a big breast? Like, what do you consider a big breast? E cups? B cups. I think for some women, a B cup might be large, and for some small women, a double D's, might be way too large. So I think there's a wide variety of body shapes, but I think in general there are some regional differences to, breast size. And also, I've actually noticed that, a lot of my women as they enter menopause may actually grow some size. So I'm noticing that I'm actually downsizing a lot of the women as they get older now. But we still have some young women who want bigger and older women who want bigger. I mean, I think it's up to the woman. It's her body, and she gets to decide within reason what's best for her.
What about the pitfalls for oversized breast augmentation?
Dissatisfaction, discomfort are certainly up there. Then ultimately, what's going to happen to their skin? Is theirs going to stretch? Are they going to be more at risk for palpability or visibility of the implant? And then ultimately just dissatisfaction and needing another procedure.
I'm seeing more people that are inquiring about sensation after augmentation. I do think there's no doubt if you overstretch the breast, there's going to be more sensory issues. Are you seeing I see a trend as that being something I'm hearing more from patients preoperatively.
I do think people are asking about nipple sensation and just breast sensation, and which I just goes that patients are more educated these days. And I think that helps me when I want patients to may have perhaps not as large of an implant, because I don't think it's the best thing for them. That's one more thing I can tell them to remind them that's not.
I just think it's part of the consultation.
Right.
People ask that all the time. But my market is a lot of secondary aug, so I think things change a little bit because many times they're dissatisfied with their previous surgery. They're too small, or vice versa, small percentage. Very rarely when they're younger do they think they're too big. They think they're too small. As they get older and they gain some weight maybe, then they think they're too big. But I rarely have to downsize someone in their 20s or 30s. You guys?
No, I agree. I think it's more going up in size. And so in Boston, when people are a little bit more conservative, it's my job to remind people that perhaps they want a little bit more of a size. So in some cases, I'm actually pushing people to have women to have just a little bit larger of implants, because I know ultimately that's what they're going to want.
There you have it. Our experts somewhat agree. There are some regional differences, but it doesn't hold true 100% of the time. If you want more information on this subject and others, you can find it at theplasticsurgerychannel.com.